Welcome to Behind the Sports Medicine Podcast. I'm the creator and host, Andrew Rizza. I'm an allied healthcare professional that has worked in the industry for over 25 years, with the majority of my practice being in the private physical therapy space and in public school athletics. My curiosity prompted me to create Behind the Sports Medicine Podcast to discuss the ever-changing landscape in the healthcare industry, focusing on sports medicine, physical therapy, athletic training, and sports science. Each week, we will discuss the barriers that healthcare professionals face and how we as individuals can collaborate to make the listeners better understand the industry for a better patient and athlete experience. Now, on to the show. This week on Behind the Sports Medicine Podcast, I'd like to welcome Vin Ferrara. Vin is the founder and CEO of Home Impact Partners and the creator of Welcome Health and Home. He has a diverse health-focused background comprised of over 25 years of experience as a researcher, MD, MBA, entrepreneur, operator, management consultant, and healthcare investor. He founded Home Impact Partners because he was inspired by the mission of helping real estate developers and investors build healthy places to live, and created Welcome Health and Home to help consumers and families optimize their homes to improve their health. Prior to founding Home Impact Partners and creating Welcome Health and Home, Vin was most recently a managing director at Ziegler, and previously a partner at Concord Health Partners. Vin launched his business career as founder and CEO at Zenith, which helped change the paradigm for concussion prevention and management in sports through a relentless commitment to both innovation and education. Vin was subsequently a managing consultant with the healthcare practice at global consulting firm McKinsey & Company, where he participated in a variety of projects for senior leaders of healthcare systems, medical device manufacturers, biopharmaceutical companies, and private equity firms. He was then a member of the corporate strategic and medical affairs team at Biogen, a leading neuroscience biopharmaceutical company, and was chief business development officer at Thorne Health Tech, an innovative consumer wellness company. Vin received an MD from Columbia University College of Physicians and Surgeons, as well as an MBA from the Columbia University Graduate School of Business, where he focused on topics related to healthcare venturing. Prior to graduate school, he worked for 3 years as a researcher fellow at the Transplantation Biology Research Center at Massachusetts General Hospital on protocols designed to increase the availability and success of organ transplants. Vin is a graduate of Harvard University, where he was a government major, and he played quarterback on the varsity football team. Good morning, Vin. Welcome to Behind the Sports Medicine Podcast.
Thanks, Riz. Nice to be with you. Good morning.
I'll talk about your new venture and how that's going to, impact people when it comes to quality of health, quality of life. This is Zara of Home Impact Partners. I consider, and I've known him for probably 25 years, right, Vin? A little bit longer than that.
Yeah, I would say back to the early 2000s, right?
We kind of crossed paths. At that time, I think my later 1990s, did my last clinical rotation at Harvard, where you were a junior or senior football player, quarterback for the team. And then later on, we connected to another venture you were, working on as far as safety of football players and helmet safety with your company. So welcome. Thank you again.
Thank you. Thanks for hosting me. It's been great keeping up our friendship over the years, and you've been a huge help to our family, especially with our kids and times of athletic need, which is quite often in our household. So appreciate everything you've done.
So Vin, tell me a little bit about this new venture, Home Impact Partners, and what your vision is of the company and what you'd like to do with it.
Great. So Home Impact Partners was born, I would say, out of the many experiences I've had in and around human health / healthcare. And it was kind of a combination of seeking to create an entrepreneurial venture that was a good fit for me and my experiences, was also, I think, seeking to do something that was well timed with regard to what I perceive, and I know a lot of others perceive, is an important societal need, which is for people to be able to maximize their health through a focus on their homes as sort of the central guiding principle for their health. And so, I started Home Impact Partners this past fall in October, and it's essentially two efforts under one umbrella. So Home Impact Partners is the company, it's the LLC. That is the brand through which we're going to be working with real estate developers and investors on the process of building healthy places to live. And my goal there is to essentially bring the voice of real people who have real health concerns, issues, aspirations, to essentially bring their voice to the process of building homes, renovating homes, building new communities. We all have some kind of health issue that we're dealing with, either ourselves or a family member. If you look at any kind of particular health condition, diabetes, obesity, mental health, et cetera, there are tens of millions of people dealing with these issues. And there's always some sort of lifestyle prescription that can be beneficial, right? The things that you eat, your access to nature, walking, movement, et cetera. And all of these things end up kind of coming right back to our homes. And so that's kind of the description of Home Impact Partners. The goal there is to work with the people that are literally building these homes and communities. As part of Home Impact Partners, there's also a consumer and family focused effort, and we're calling that Welcome Health and Home. So we started there with a consumer focused newsletter at that same domain, welcomehealthandhome.com. And we started putting out information that we think can help people optimize their home environment in order to maximize their health. And when I say home environment, I mean literally their home, whether that's a single family home, an apartment, whether they own it, rent it, live with their parents, regardless of what age you're at, but also that extends into their surrounding community. And so we have this matrix essentially of 10 elements of the health and home environment. And so we're building our newsletter around those 10 elements. We just got started a handful of weeks ago and looking to grow subscribers, but also looking to build a network of partners, companies and organizations that can bring products, bring services, bring information to people. And so we're working kind of at both ends of the spectrum, the consumer and family end of the spectrum, and also the real estate developer and investor end of the spectrum. So it's a brand new venture. It's kind of pursuing two paths that are not only parallel, but sometimes they cross also. So I'm glad to be with you and talk a little bit about it today.
Probably a few months back, and as I looked at this, and it kind of bridges a gap for us too, I think, in athletic training and physical therapy together. I look at some of the things that your company's about. So when you look at what things make a healthy home, you look at environment, healthcare, movement, the social connection, education, safety, transportation, like all those things rolled up. And when I look at physical therapy and athletic training, I know that we need a lot of those elements aren't clearly defined, but if we really break down the person we're working with, there are some things there that impact their recovery, right? So if there's not a good social connection between myself and the patient or the athlete, then their recovery and their outcome's terrible. If they're not moving, if they're not bought into the healthcare system, if they don't have education from us, if they're not safe at home or have safety that part, and they can't get to where they need to be, then that becomes a problem with their recovery as well. And same with the environment. If they don't have a good environment, you talk about tissue health and people being able to develop and get better. If somebody is not breathing the greatest air they can breathe at home, their tissue, then the perfusion of that oxygen across the tissue doesn't help them heal. So there's definitely this correlation of what you're doing and what I'm thinking of and what we do every day has a direct relationship. And that's why I felt that, our conversation today would be impactful for the people that are listening.
Thank you. Yeah, it's an important point. I mean, having spent time, close to 30 years now in healthcare, there's, I would say, healthcare practitioners, and I'm an MD, medical doctor. I didn't ultimately practice medicine, as you know, I went into the business side of health, but watching, healthcare professionals like yourself, Dr. Yen, et cetera, that are actually involved in patient care, you know, you're often on the receiving end, the downstream end of people's um, the ramifications of their environments or their behaviors or their lifestyles. In some cases, it's a fluke injury that nobody really could have predicted. In other cases, maybe it could have been prevented if the environment was optimized in some way. But in any event, you're generally on the receiving end of someone who's in need of something, and your time with them is quite limited, right? You may get a half an hour to an hour with that person if it's an athlete, or one of the things I'm always fascinated by is your field of athletic training, physical therapy. I got interested in medicine as a result of that, being an athlete and getting injured and put back on the field, et cetera. But your field spans, every age group. And if you walk into an athletic training facility, a physical therapy facility, you see people of all ages. And in some way, shape, or form, their home environment is going to be very important in their recovery. And if their home environment isn't helpful, or if it's sort of a negative effect, your ability as a practitioner to help them goes way down, right?
It
That
does,
time that
yeah.
you have with them, you can help them in that moment, and then you need them for the next 24 hours or 72 hours or whatever the time span in between. You need that time to be well spent. And the reality is, if you look at the statistics, uh, people spend over like 2/3 or more of their time in their home. And we're all heavily influenced by our environments. And the environment in which you spend the most time for most people is the home.
Yeah.
And so that is a critical part of your capabilities as a healthcare practitioner is, what is going on in the home environment, what's going on when that person leaves your care. Is it complementary to what you've been doing, or is it contrary to what you've been doing?
Same, because I saw that it was 90% of the population spends time indoors, and that two
The
thirds,
stat is we spend 90% of our time indoors
yeah, which is
and
crazy
two
to think
thirds of
about it,
that time in our
in your
homes.
home, and then a third of that in your bedroom sleeping. So if the air quality and the environment is terrible, then you're not actually gonna, be able to maximize that health benefit, right? So it is quite interesting to see those statistics. And I think, going back to your newsletter, you had the newsletter I had just looked at and had a chance to read was um, there was the Harvard T.H. Chan School of Public Health has 9 foundations of a healthy building and what that looks like. And not in particular order, but the ventilation, air quality, thermal health, moisture, dust and pests, lighting and noise, lighting and views, noise, and the water quality, and obviously safety and security is a part of that. Um, Briefly, you and I talked pre-recording about, um, you know, we had just, 4 or 5 years ago, I built a new house, and we were talking about air quality in the house, and the thing that I didn't have a lot of experience with HVAC units, and we were having some issues with some air quality, and the contractor said, "Oh, you have to every time the clocks change, every 6 months, you got to do two things. You got to change your filters in your. It's a good time to change the filters in your units to make sure that they're clean, so you get good air quality in the house." And also the other thing we don't think about is you're changing the batteries in your smoke detectors, right? So those are things like we just kind of, don't really think about. But the other piece of that is the moisture in the home, where we have a lot of people that end up, getting sick or have allergies, but they don't realize that could be mold related, it could be moisture related, and how do we control that? And some people don't understand that. So I think it's pretty valuable that you guys are putting this information out for the public on that side of the business to be able to read this and understand it and kind of see some of the statistics behind it so they can start to live healthier quality lives.
Thanks. Yeah, the air quality issue is a really interesting one because um, I think over the years, let's say we've gotten more attuned to thinking and talking about outdoor air quality, and certainly with climate change, I think people are probably paying more attention to that. And I would say probably not paying attention necessarily to indoor air quality. And, I've been in health now for close to 30 years and really just started thinking and learning about that topic myself, months ago as I got into this venture. And I came on that document. So Harvard's School of Public Health has this Homes for Health program. Dr. Pierce McNaughton has been very helpful to me. He's someone who's actually starting a home assessment business. And so he's someone who, is going to be a partner of ours that we think can be really helpful to our reader base. And he's one of the co-authors of the Homes for Health program. And if you look at that document, you mentioned the 9 foundations of a healthy building, air quality and ventilation, which are very related to each other, are right at the top of their graphic. And then there are 36 tips for a healthy home that are part of that. And fully half of them are related to air in some way, shape, or form.
Mm-hmm.
So yeah, just a really, really interesting topic. And as we've gotten out of the gate here with this newsletter and seeking to organize information and figure out what's most important to people, it's become clear there are so many topics at this intersection of health and home. And so our task is to organize those topics and get them out to people in a way that is well sequenced and compelling. And my goal really is to bring the expertise of others that are also at this intersection of health and home, bring that expertise to our readers.
The consumer side of the business and what you're trying to do you see yourself, targeting or branching out into the athletic, community for families or young families in the future? Is that something that you're thinking of, or is that too far out in the distance for you at this point?
It's not too far out, and it's an important question. And athletics has been such an important part of my life and my family's life. Um, it'd be hard to conceive that it wouldn't be relevant to what we're doing. I think a lot of particular sports training, whether it's particular athletic movements, whether they're sports specific or they're sort of general athletic movements, a lot of those can be done at home. I know, when our kids were younger, I set up a wall with a net, kind of a rebound net that they could throw into. We have the first thing we did when we moved into our house was pave a basketball court in the back, put up a wall, that they could throw against. And so I'm a big believer in the ways in which the home environment can be used to foster athletic performance. And again, not just for the sake of winning sports games and stuff, but for the sake of what movement, and a healthy appreciation for movement and sport can do for people's physical health or mental health. So I think it's pretty much inevitable that we will have athletics as kind of a key component of what we're doing. As you know, physical therapy, sports medicine is also coming into the home, literally through digital health mechanisms. One of our sons had an ACL tear 4 years ago, kind of right before COVID ramped up, and was fortunate to get the surgery in before hospitals started shutting down.
Mm-hmm.
And the beginning of his physical therapy was done at home, sort of improvised through Zoom calls and whatnot in our living room, And so there's a huge connection between the home itself and sports and movement. And as I mentioned before, when I say the home environment, I'm also including the surrounding community. So to me, it automatically incorporates sort of the local programs. And that the decision around what sports to participate in, what programs to plan, what's a good fit for your kids, what's healthy, I think is something that it's certainly important to me. And I think there's a lot of information that we can provide to people that's some value. So To answer your question, I think the answer is yes. It's inevitable that we'll have a lot of intersection with the athletics space.
Impact. And that's the one thing that I find is the biggest determining factor for anybody recovering from athletic, injury or just, an injury that comes into the clinic, right? If somebody isn't engaged and they don't have a good understanding and education on what the outcome looks like or the prognosis looks like for them, then mentally they can downward spiral, right? And we can really have a problem on our hands with depression, anxiety. There's a lot of things that factor in. And I think you have to have a strong base at home, a strong foundation in order for that to become successful for that person. And we really don't know what's going on outside of the clinic or the athletic training room unless we really engage with that person and understand what they're going through every day. So it's important for us to ask questions and understand them. There is a questionnaire that's filled out, if someone comes into therapy or athletic training, which is called the VR-12, which is general health related question. And people sometimes look at it and say, this kind of looks like a psychology questionnaire. What is this all about? Yeah. And I think once you educate them on the why, we want to understand what's going on outside the clinic so we can make sure they're healing it properly. And I talk to young athletes a lot about how they recover and how it's going to look like for them, because with your kids and with yourself with injury, there's that sense of like, okay, now I'm getting removed from what I like to do the most with the peers that I like to be with and be around. Now I can't be involved. How do we mentally prepare them to get them involved? And that's the environment we got to put them back into. And if I have an athlete that has an ankle sprain, they're a lacrosse player, I might have them go out to the field and said, you know what, you can stand there, warm the goalie up and be part of the team, or you can help educate the younger kids to stay involved. And that piece of mental feedback for them is enough to keep them motivated to want to get better. So I think that whole compounding atmosphere and foundation around them and their family is a big, big factor in their recovery.
Yeah, it's a great point, and that technique of saying, hey, you can warm up the goalie, super important and a great concept to keep that player, that athlete connected to their team, contributing value. That it's a way, I think, of combining, sort of a therapeutic approach, a return to movement, a return to the field, combining it with a social connection element, keeping them connected to their peers, and also contributing value to the team so that the other players can look at that person and say, that guy, that gal is awesome, right? They're injured, but they're out here still trying to help the team. So there's ways in which you can kind of recast the situation like an injury, and put it in a new light and keep the child connected with their peers. And the same thing at the other end of the age spectrum, if a senior has an injury or for some reason, is unable to get outside, get in nature, connect with their peers, that can have tangible effects. I know that happened to my mother. My mother had undiagnosed diabetes for a long, long time. She was of a generation of Italian Americans where, at least for the women, if when you were done having babies, you didn't go to the doctor anymore, at least in my mother's neighborhood. And so my mother went for like 30 years without going to a doctor. Mm-hmm. And when she finally was having these symptoms, they were like, you have full-blown diabetes. I mean, her hemoglobin A1C was like 14. And we have no idea how long that was going on for. And they got it sort of under near-term control, got the blood sugar down. But the damage had been done. Like she started to experience diabetic neuropathy, foot pain, and she had to stop working. She worked in a cancer clinic down at the Jersey Shore. She managed an office checking in patients, and that brought her a lot of value. She walked every day out on the boardwalk, and then that all stopped at a certain point, and she experienced pretty profound mental decline. And, so a lot of that really had to do with being unable to move in the way that she had been used to.
Yeah.
And so the main point there, especially for seniors, keeping them active, keeping them connected through movement is an incredibly valuable mission.
A good amount of Medicare patients that come into the clinic in Wellesley, and the great thing about Wellesley, they have an unbelievable senior center, which is right down the street from us. So again, we don't know outside of the clinic what they're going through. I had a patient last year, gentleman we were trying to, discharge from therapy, and I think you and I briefly might have chatted about this. Um, he had he was doing great, had a knee injury, was completely functional, back to normal activity, and I was trying to discharge him. And he and I didn't know. I knew that his wife had passed away a couple months prior, and him and I were just chatting, and he said, "You know what? I just wake up sad every day." He's like, "I wake up, I don't know what to do." And for him, the exit strategy for him, or to feel better, was to go to therapy every day and engage with those people. So for him, that was his mental kind of up, being up and feeling better, is that mental capacity of being able to engage with people. So I introduced him to the senior center, and I said, you know what, this is going to be a great thing for you. You're going to meet people. You're going to be able to get out in the community, and this is going to help you. And, he thanked me for that, which was, for me, it's rewarding because we did something for him that we really didn't know about until we got to the point where we were like, you're all better. We have to discharge you. Um, but I think he valued that conversation, and that, he doesn't have that engagement at home. So
Yeah.
for him, he's got some family in town, which is great. They're close to him, but he needed other people to be around. So that mental component is huge when it comes to recovery and for healing.
Yeah, it is. And that's a credit to you and others like you when you practice your profession, the art of conversation. I think is a huge part of the physical therapist world. And I've watched you in action, whether it's helping me or my kids. That conversation piece I think is super important, and it obviously helped you uncover something for someone that was really important. And I know from thinking back to athletic days, the athletic trainer and the athletic training room is such a critical element of the experience for young athletes. And it's so much of the memories that I think athletes have are in that athletic training
In that
room.
space, yeah.
Yeah, with their teammates, with their athletic. I mean, I think back to our times at Harvard with TK Kennedy, Gary Geisler, Mo, Anthony. Those are some of the most vivid memories.
Yeah.
Just because you're in your social element. If you're in that room, it probably means something is up. You need help with. It's kind of a vulnerable time sometimes if you're injured, and that conversation in that room a lot of times is you know it's always interesting, it's always valuable, and obviously that story you just told, that doesn't go away, that matters all the way through
Yeah. Yeah. And it's an environment that people like to be involved with, like you said. Like I had my episode 2, I was had a physician who's from Ortho, Arizona, who's actually a former Weston grad, and he said, we all love going to the athletic training room. He's like, hurt or not, that was like the social place to be, but it was also good because it was like an extension of them as athletes, right? So they like to come in, if they had a quick question, they would ask and try to,
yeah
figure out what was going on with them, if anything. But I feel like in, high school, and even if you look into college, like the athletic trainers are an extension of your parents, right? For you, it's a comfort area. So if you needed something, you knew somebody was looking out for you, and that they were going to take care of you in the right way, because your parents might be thousands of miles away and they're not around the corner for you to be able to go to. So I think mentally
yeah
that's a good.
as we're talking, I'm like, what, we need the version of this for non-athletes too, like it's somebody, just a
We do.
place where kids can go and hang out and talk and get a little bit of information, a little bit of advice, a little bit of social connection. It'd be a valuable thing for people to have, even if they weren't on the sports team.
Um, Looking past the athletic piece, do you feel like, with your relationships with physicians that you went to school at Harvard or even to Columbia Medical School, what does it look like as far as the public health or even private health sector for you? Has there been conversations yet about that and how to work with that within the organizations that you have connections with, or peers that you'd work with or gone to school with, and helping to get the message out?
Yeah, it's definitely a goal of mine to bring that network that I've been fortunate enough to develop to bear in this new initiative. One of the things I want to do is do what you're doing is start a podcast and interview people, interesting people. And so when I think about classmates of mine, teammates of mine, who went on to practice medicine and gathering and telling their stories, not just about their professions, but about their own personal experiences as students, as athletes, as just as human beings, right? Their own health needs and conditions, those of their family members. So I'm planning to do outreach on that front. I'm interested also in how we can bring information and initiatives that are going on at hospitals and health systems to people. So there's massive change going on in the healthcare industry in terms of how healthcare is moving to the home. And, COVID accelerated that very rapidly. So the rise of telemedicine, the rise of home-based primary care, essentially the return of house calls, the rise of hospital at home, providing more acute care. There is an increase in sort of digital therapeutics now. We have these things called prescription digital therapeutics that are essentially apps that you can engage via your smartphone or a computer-based app, and it takes you through certain steps and stages. And there's those are FDA, clinical trial approved. So there's real therapeutics that are coming home. There are clinical trials, even extending to gather information from people at home. There's blood testing, saliva testing, gut microbiome testing. There's all these ways that health is coming into the home. And there's not only private companies, technology companies and startups that are seeking to do that, but real established hospitals and health systems are seeking to do the same thing. So I had a recent conversation with Steve Wiviat, who's a neighbor here in Wellesley, and he's a cardiologist at Mass General Brigham. And we had a conversation around how, they're looking at extending their clinical trial approaches to reach people in their homes, and how Mass General Brigham and frankly, all other systems, I don't mean to just plug Mass General Brigham, but all other systems are trying to engage people in their homes. And so one of the upcoming newsletters we're planning is just sort of an overview of all those things I just rattled off, so that consumers can understand their options, right? Mm-hmm. Healthcare for a lot of people is consumed in a very traditional fashion, right? You call the doctor, you make an appointment. It's, if you're lucky, it's within a couple of weeks. But there are new ways of consuming healthcare, and hospitals and health systems are really keenly trying to reach people in their homes. That is the future of healthcare, and especially with the aging population that we have, tens of millions of people that are reaching, senior ages in the coming years. It's going to be imperative for our country, really for the world, but just, certainly keeping these folks in our country for a moment. It's imperative that healthcare reaches people at home. So we want to be part of that somehow, for sure.
There's a lot of populations that don't reach healthcare, right? They don't get out to the hospital. They don't get to their primary care. You made a comment about your mother had, after so many years, wasn't seen by somebody. So how can you bring that into the home so they can have easy testing, right, with technology, and to be able to catch some of these, comorbidities that people aren't picking up? And, it'd be interesting to see the statistics across the country of how many people do not get to healthcare practitioners to be able to find out some of the things that their body is going through that could have been prevented if they got there a year ago or 6 months ago. And the technology is definitely there. Just how do you box that, and how do you put it to good use, right?
Yeah. The technology is there. I think it's, part of it is messaging, letting people know what's available. Huge topic in our healthcare system is just the sort of financial incentives involved, and who's paying for what and when. Our system in the United States, I think, is the envy of the world when it comes to providing specialized high-end care. I mean, people come from all over the world to the United States, and I know, our family has needed that high-end care, Boston Children's, et cetera. We've needed it multiple times. So our system is incredible at that. Our system is not great when it comes to what I call the upstream, sort of earlier preventive type
Medicine.
care.
Yeah.
Yeah, and that's where part of my interest in the intersection of health and home comes from, is that the the upstream components of your health, your behaviors, your choices, your environments, things that happen at a young age, because you spend so much time in your home, so much of your health is going to be dictated by what's happening at home. And if our health system had continuity between what was happening at home, back to the beginning of our conversation, if there were continuity between what was happening at home and what's happening in the actual healthcare delivery space, we have a lot better outcomes. The health of our country, the United States, is surprisingly poor when you look at metrics compared to other wealthy nations. It's actually fairly startling, some of the statistics, actually.
Thank you for tuning in to Behind the Sports Medicine Podcast. This is your creator and host, Andrew Rizza. If you enjoyed the content from today's episode, give us a like, leave a comment, and share on social media. You can also find us on Apple, Spotify, and wherever you listen to your podcasts. You can follow us on Instagram at Behind Sports Med Podcast, on X under AJR Sports Sci, or check out our websites at ajrsportscience.podbean.com and at ajrsportscience.com. You can also subscribe to our YouTube channel at AJR Sports Science. Tune in next week for part 2, where Vin and I conclude our conversation discussing the challenges in healthcare systems and the need for healthcare to reach people in their homes. We discuss the need for awareness and access to healthcare, highlighting the importance of addressing both the economic impact and the availability of resources. Vin goes on to explain his goal of working with developers and builders to create healthier communities and improve the health impact of the built environment. Vin then emphasizes the role of the environment in influencing behaviors and genetics and the importance of making daily choices for better health. We wrap up our conversation with some advice for students pursuing careers in health and business, emphasizing the value of mentorship, and finally reflecting on his career journey and the evolution of his focus on health and home.